Hey Yadong, you know what? I've recently noticed more and more patients asking for minimally invasive treatment for benign prostate enlargement. Have you noticed the same pattern?
Yes, Edwin. I think it's a trend. There are some great benefits from it. Shall we talk about it today?
Absolutely. Hello everyone, my name is Edwin. I'm a consultant urologist with Singapore General Hospital, and I've been practicing urology for about 10 years now, and my special interest lies in benign prostate hyperplasia or BPH and kidney transplantation.
Hi everyone, I'm Dr. Yadong. I'm an associate consultant urologist from Singapore General Hospital Department of Urology. I have a special interest in men's health, andrology, and endourology. So first things first, why does prostate enlarge?
Okay, so the exact cause for prostate enlargement is not known, but it is thought to be linked with the changes in the male hormones with age. So therefore, the main risk factors that we know for prostate enlargement is male aging, and also I think there's a genetic component to it as well. That's why for people with a family history of prostate enlargement, men will have a higher chance of prostate enlargement as well.
I think there are some evidence to suggest that dietary factors such as red meat consumption, excessive calorie intake may have been associated with benign prostate enlargement as well. Therefore, maintaining a healthy weight, regular exercise, and not smoking may be helpful.
Yep. But it is important to know that prostate enlargement cannot be prevented. This is just a natural process of male aging. So Yadong, does having BPH means that there's a higher risk of having prostate cancer?
Well, benign prostate hyperplasia, benign means not cancer, and BPH is not being associated with prostate cancer and does not increase the risk of prostate cancer as well. We all know that there is a tumor marker called prostate-specific antigen, PSA, that can be used. It can be raised both in BPH and prostate cancer, but generally speaking, in BPH, the raise is not as steep as seen in prostate cancer.
Yep. So when you see your urologist, the first thing that he or she will do is to exclude prostate cancer first, and that can include the tests like blood tests, MRI scan, or even a prostate biopsy.
So Edwin, many of my patients ask me about surgical treatment of BPH and they're worried about impotence.
Yeah. Before we talk about the surgery for BPH, I think it is also important to know that the first step to treatment is always medications first, but such medications for BPH do carry some side effects, and this can include giddiness, abnormal ejaculations, and even impotence or erectile dysfunction. The surgery for BPH, the conventional treatment, is transurethral resection of the prostate, or known as TURP, and it remains the gold standard to this date. But there are long-term side effects associated with this treatment, and one of it is a small risk of impotence in the long run. With the newer minimally invasive treatment options for BPH, patients now have more options to preserve their sexual functions, especially their erectile function and the ejaculation function as well. Treatments such as prostatic urethral lift has not been known to cause erectile problems or ejaculation problems in the long run.
Yes, Edwin. The other part of sexual health is about ejaculation. Conventional procedures such as TURP, right, you mentioned, will likely cause retrograde ejaculation. It's a condition where they also call it dry orgasm, where the semen, instead of emerging through the penis, actually goes flow back into the bladder. PUL is one of the procedures that preserves your ejaculation, and SGH Urology has performed many PUL procedures. The immediate flow improvement, wean off the medication, and preservation of ejaculation and sexual function has made it an attractive option for minimally invasive treatment for BPH.
Yep, and there are also many other options for minimally invasive treatments for BPH, and this can include treatments like water vapor therapy for BPH, water jet ablation, or even a temporary prostatic urethral stent. So will BPH come back after treatment?
Oh yes, there is a small chance of recurrence, especially for conventional procedures such as TURP that we just talked about that didn't remove the excessive prostatic tissue.
Yeah, so the minimally invasive treatment options are quite new. We have about 5 years data so far. For example, for prostatic urethral lift, there is a certain retreatment rate of about 10 to 15%. But ultimately it is up to the patient's preferences and lifestyle, and we individualize our treatment options for the patients.
Yes, I absolutely agree. We always have a very open conversation with our patient with regards to the BPH treatment.
Okay, so I hope we've answered some of your questions on BPH.
If you have any doubts or concerns, you can always speak to your friendly urologist to have your condition evaluated thoroughly.
Yeah, and there are always advances in the treatment for BPH, and now it is possible for us to gain control of the condition while regaining some quality of life.
Thank you.
Okay, bye-bye.
Bye.